Hi.
So far, so good. Good.
That's a good thing.
I was getting worried.
Yeah.
Hello, everyone waiting in the waiting room.
Okay.
Thank you, Mitty. I have any idea what happened to it, but you did a nice job on that.
Who just said that?
Oh, that's Connie. It's me. I guess
Oh,
I
hi,
should-
Connie. Did you find it?
No, I never did find it, but you resent it. So there.
Oh, good, good. Okay.
Yeah, that's worth keeping. That's excellent. Melissa,
Yeah,
you said you sent, was that Chuck Larson? You said you sent the application, but we already had it.
interesting. So he sent me the actual paper copy in the mail. And I was kind of thinking that too. I kind of felt like we had already seen an application
Yeah.
from Chuck. But
Right
I
here.
didn't, I didn't double check that before I sent the email. So anyway.
Well, and it wasn't on the email. I mean, if you were
Right,
gonna
because
resend-
I didn't scan it yet to send
Oh,
it to
yeah.
you. Now
You
I
don't have to.
Yep,
You don't have to do it. Yeah,
Right.
we're gonna put his name up for a vote today. So
That's right.
Hello. Hello, can you hear me?
we hear you.
Yes, we
don't
can.
see you.
We can hear you.
Perfect.
So which Dave is on the phone, Betzler or McEwen?
This is Betzler right now.
Okay.
I'm wait, can you see me on the, can you see me?
No, not yet, Dave.
So,
No?
No.
How about now?
There you go.
There you are.
There
Oh,
is-
perfect.
And the tie, is that for us?
I'm not typically this dressed up for a Zoom meeting. I got to go to a funeral after this.
Oh, no.
Oh. That's kind of late in the day for a funeral, isn't it?
Well, it's 6 o'clock. We just got to get ready for it and go.
Wow. My
Gentleman,
cousin. Go ahead. I'm sorry.
the gentleman was 92 and he's was a missionary in Angola.
Oh,
oh, that's sad.
and my cousin's funeral's tomorrow. She was 90. So any word on Claire?
I see that
Oh.
she had the baby.
She what?
She had the baby.
Oh, yay.
I saw, I think 2 days ago, a little boy, and everyone's doing good apparently. So
Oh, that's wonderful.
Wait,
see, I think I saw the name too.
Did you get that from Facebook or?
Yeah, her and I are friends. Let's see. Gerald Douglas,
Oh,
7 pounds, 13 ounces.
what was the weight?
7 pounds, 13 ounces, and everybody's doing good.
Okay.
Had the baby on Monday.
That's wonderful. So Melissa, if we want to send her congratulations, like a card or something, does she want her address given out or how do we do that?
I would imagine that she'll be fine sending out her address. And I might be able to get it from Mei Ling, who is the program person now with
Right.
Innovations. So I can ask her, or, Elisa, I don't know if you
I
think
can ask Claire directly, yeah, too, and just say we'd like to send a group card. I can sign it from all of us at the Commission on Aging.
oh, that'd be great.
Yeah, I'll take care of that.
Oh, thank you.
Hey, it looks like it is 3:01. So I am going to officially call this meeting to order and let's see if we have a quorum. I think we do, right? Melissa?
Yes. Yep.
Okay. Well, I hope everybody's well this beautiful day. I love this warm weather and a
Yes.
chance for all of us to get outside. Okay, I see we have some guests to welcome, and I do not recognize names. So I just want to welcome, I see Gretchen Bricker. That's not a name I'm familiar with. Gretchen, are you visiting us today? Can you tell us a little bit about yourself?
Hi, I'm sorry. I was running all over the screen trying to get back in. Back in.
That's okay.
I am Gretchen Bricker. I am the Direct Services Supervisor at the Area Agency on Aging.
Very good. Well, thank you for coming. We're glad you're here. And I also see we have Laura Cruz.
Yes, hi. I am the mobility coordinator for PPACG. So
Well,
thanks
that's
for
great.
having me.
Well, we're glad you're here. We have you on our list of agencies to liaison with. So now we have a face to connect to that.
Sounds great.
Then we have Karen Morgan. Karen, you're on mute. You're still on mute.
So Karen's computer might not,
Okay.
kind of like mine, it might be acting up and we might not be able to hear her.
Okay, well, we're glad you're here, Karen, and I hope you can hear us. Okay, and then we have Jennifer Horn.
Hi, I am Jennifer Horn, and I also work at the Pikes Peak Area Agency on Aging in the Family Caregiver Support Center.
Wonderful. Okay. Did I miss any guest? Okay, well then also welcome to our staff. We have Melissa here and I saw, who else was there? Jessica. So we have 2 staff members and then we have our very own commission members. And for those of you who are visiting, I'm just going to mention their names. When I mention your name, just raise your hand so our visitors can see who you are. But we have Elisa, who is our vice chair, and she's also on the membership committee. We have Connie, who is chair of our membership committee. Claire is not here. She is chair of our policy and legislation committee, but she just had a baby, so we're all excited about that. But we also have Vanessa here, who is also on the policy and legislation committee, and she has agreed to be interim chair while Clara is out with baby. And we also have Kelsey, and she too is a member of the Policy and Legislation Committee. I don't see David, but we have Paula Levy here. Paula is a brand new commission member, and she just came on the commission last year, as did Dave Betzler, and he's here as well. So let's see, did I miss anybody? CJ had to say she couldn't make it today. And then there's myself. I'm Mitty Pedraza, and I am chair of the commission. And now we totally have 10 members on the commission. So that is good news. And thank you so much to the membership chair. Okay, let's move to the consent items. And so for the commission members, do I hear a motion to accept the minutes of March and the agenda of
So moved.
Second,
moved and seconded? All in favor? I don't have to do that. It's so right, it's a consent item. Sorry. I have to remember my Robert's Rules of Orders. All right, so that's good. And I don't think we have anything for public comments. Am I right, Melissa? No public comments. Okay. So let's move on to action items, and I'm going to turn to Connie here. Do we have any action items from the membership committee today?
We do. We have, is this the time where we do the
This
applicants?
is it.
All
This is
right.
it.
So we had 2 interviews, one with Chuck Larson. He's from Fountain Valley. He's the president of the senior center there. He has lived in the area for 57 years. Is very well connected, and he is very excited to be on our commission. So that is his. And then Debbie Swanson. She was hoping to be on this meeting. We interviewed her. She is the Senior Resource Council chair, and she comes to us. She's also worked with the Girl Scouts of Colorado as a fundraising manager and Early Connections Learning Center, and she is very interested and particularly with her new position to learning more about seniors and how we can help them. Plus, she has a mother-in-law who lives in her basement, so she is living it firsthand on the needs of seniors in our community.
Well, thank you, Connie. I just realized too, as you were talking and I was doing the introductions, I missed Chuck. And thank you for being here, Chuck, and thank you for applying to become a member. Okay, I'm sorry. I didn't mean to interrupt, Connie. Go ahead.
That's fine. And we have another application. She could not meet, couldn't make this meeting, but she's gonna come to be on the Zoom for the next meeting. And then that's Eileen Flanagan, and we'll see how she feels about that after coming on another meeting. So if there's anybody out there who has connections, we're still really looking for people in Park County.
So we don't have any action to take today. Is that what I'm understanding, Connie?
Well, I think we need to vote on the 2 that we have. I didn't know
so
if that was down later or that's right now.
No, that would be an action item we're doing right now. So,
Okay.
so
So,
you can make the recommendation.
Okay, so on behalf of the membership committee, I would like to make, first of all, I'd like to recommend acceptance of these 2 applicants, Debbie Swanson and Charles Larson, to the Commission on Aging. So I make the motion that we approve them.
I second.
Can you
Okay,
repeat the 2 names, please? I still haven't heard them.
Right. So now we're going to go to the discussion. The motion's been made and seconded. And so let's do this. Let's just hear from Chuck for a minute. Tell us, tell us a little bit about yourself and why you decided to join our commission.
Had to get my unmute off. I'm a retired financial advisor. I've been in the area for getting close to 60 years. Been highly involved with the Fountain Valley Senior Center in the outlying areas and transportation, that kind of thing. So I was asked if I would like to join this group, and I said, yes, that sounds good to me.
Okay. And it's good to have representation from the Fountain area. That's wonderful. Okay, so, and I know Debbie's not here, so we'll get a chance to meet her at another time. So the motion's been made and seconded. Any other discussions or questions? Then all in favor of our 2 new members, please indicate by raising your hand.
If you can see. Aye.
Okay, did you
Aye.
get that, Melissa? Okay, well, welcome, Chuck, and welcome, Debbie, and I look forward to meeting Debbie and reaching out and talking to Chuck a little bit and getting to know him as well. All right, so the next item on our agenda is information items, and Connie, you talked about a little bit about the need for more members and searching for members. Is there anything you want to add to that?
No, I've said, I think this is such a crucial time that, we need to be reaching out to all the different areas. So we make sure that we're getting their needs covered. what are the needs in these outlying areas as opposed to, the city. So just any kind of input that anybody has with that, or recommendations of someone who might be, even if you want to be part of the membership committee for even a short term to help us fill in these slots.
And we're working on a map to determine where there are gaps. And I just wanted to note, Mitty, Connie, myself met with Lucy Crandall of Senior Blue Book. And so we also, she's going to try and help us identify people in Park County as well.
Yeah, we've got feelers out there.
So let me ask you this question. This is to Connie and Elisa. Do you need more members to join your little membership committee?
Yeah, I think so. I absolutely do. I'd like to see at least 2 more. Again, to help reach those outlying areas.
Okay.
So Debbie is trying to get on, but she has said the meeting hasn't started.
So I will reach out to Debbie here in a second and give her, because if you recall, there was the screw up of the 2 different meeting notices. So I will forward her the right one, Connie, if you can just tell her. So I will do
And
that.
I also, okay, thank you, Melissa. I also noticed Paula had her hand up. Were you volunteering?
I was to be on the membership committee.
Yay.
Oh, I love that.
Wonderful. Wonderful, Paula. Thank you so much. We appreciate that. Okay, so now, anything else about membership?
Nope, not at this time.
Okay, thank you, Connie. Thank you, Alyssa, and thank you, Paula. All right, so let's move to the Policy and Legislation Committee. And like I already said, Claire is the chair of that. She is out, and Vanessa is stepping up as interim chair. And Vanessa, do you want to share with the group what's happening?
Yes,
What the plan is.
Absolutely. So the oh goodness, we're going to call it the policy subcommittee meeting. We met on March 24th, which was the last Wednesday, and we are going to continue to meet on the 4th Wednesday of every month. We quickly worked through some goals for our committee. So we have some direction. We're going to be monitoring state and local legislation that affects aging adults. And we're going to look at creating an impactful method for the group to target that, to track the legislation. We also talked about making preliminary plans to visit the Capitol for the next in-person senior lobby day. Yeah, and then we talked a little also about understanding that these are not my notes, I'm sorry. Understanding the best method to gather legislative info from the 16 member governments. I think right now what we're looking at is state laws, that we have kind of a handle on what's going on there, or at least the trackers that we talked about during our meeting were all state level. So we're going to be talking about working through that at our next meeting. And I think that's it.
I think you're right, Vanessa. Does anyone have any questions for her?
What's the meeting? Did you meet the 4th what?
The 4th Wednesday.
Wednesday.
So I have a couple of comments to share. Mitty, if that's okay.
Sure, go ahead.
So first off, congratulations. Thank you, committee, for meeting and doing all that good work. First comment is Jessica McMullen, who is the policy and communications person for the Pikes Peak Area Council of Governments, would love to attend your committee meetings so that she can continue to monitor the overlap, and I may turn this over to her here in a second to see if she has anything to add and share with you guys. So she would like to be invited to those meetings, and then that will be a really great liaison between the AAA and the Council of Governments. And of course, she probably doesn't want me to say this, but she is very connected to all of our elected officials because of her role that she plays with our organization. So she'll be a really significant asset for you guys. The second thing I wanted to share, that in a few minutes, Jody Barker had sent Mitty and I the agenda for the N4A policy conference that's happening at the end of April. So I do want to put that up on the screen in a few minutes for everybody to see. We are able to pay for one commission member to attend that event, and it runs for, I think, 3 days. So just wanted to put that up here in a few minutes for some comments. So before I do that though, Jessica, do you want to share anything with the policy committee?
I just wanted to let you guys know, so my goal is to help make sure that we're all connecting with the PPACG Legislative Committee and the Policy Committee with you guys, and communicating clearly and making sure that everybody is aware of legislation that might be impacting, as well as keeping you guys abreast of what positions and things the PPACG board is already taking on with our lobbyist, and also making sure that we're taking on the issues that are of concern to you. So I'd like to join if you guys don't mind including me, please.
I think that sounds lovely. I will make sure you get on those invites.
One
Thank you.
other suggestion, sort of in the longer term and sort of in a background consideration, is that other AAAs are probably doing a likewise effort to monitor and to track legislation. At some point down the road, no hurry, but it would be probably worthwhile to try to reach out to, say, DRCOG, the big one up in Denver, and maybe north of that, the Fort Collins and the Weld County ones, just to see what they're doing and if there are potential areas and initiatives that they have that we might be benefit from. So it's just an info item at this point, no urgency.
I also have a comment too. So I am a new volunteer for the Colorado Senior Lobby, and they have extended for the Commission on Aging, for the Commission on Aging to, I have a link that I can share to anyone who wants to attend their legislative committee meetings every Monday from 9:30 to 11:30. And also I will be the liaison between us and the Colorado Senior Lobby, just because I'm volunteering and I can easily bring back information. But Vanessa, I can send you that link that she had sent me to see if you guys would like to attend.
Actually, yeah, we talked about that. I think there's a few of us on the committee, so we talked about making a schedule to make sure that there's one of us at every meeting, and then we would meet about it all at the end of the month. So that would be great. We have the link.
Oh, you have the link. Okay,
yeah,
perfect.
I think we're good. I'm not sure if anybody has attended since our meeting a few weeks ago.
Okay.
I haven't gotten the chance to, but I am planning to before our next subcommittee meeting. So I think we'll go from there. Yeah, thank you so much.
It sounds like to me, Vanessa, that the Policy and Legislation Subcommittee has a full plate of activities to look at, right? And so far on that committee, we have Vanessa, Kelsey, Claire, and myself. So if there are any other interested individuals, please let us know, okay? And before I move on to or let Melissa talk about this upcoming conference, I just wanted to say very quickly, welcome, Debbie. I just saw you on, and you are on now, and you are officially a member of the Commission on Aging. And so we look forward to getting to know you. So thank you for being here.
Thank you. Glad to be here.
So Melissa, do you want to talk more about this conference?
Sure. So I'm hoping that this is now up on the screen. You all are seeing the N4A Aging Policy and Advocacy Summit. Some head nods, please.
Yes, we see it.
Great.
Yep.
So again, this would be kind of targeted specifically for the policy folks. And it is April 27th through the 29th. And we are paying for one person to want to attend. And so here's kind of, some ideas and some of the things that are happening. So it looks like it's in the afternoon, 1 to 5 on Tuesday, Wednesday, Thursday. So it's not all day long. It's just kind of an afternoon thing. And you can kind of see some of the subject areas that they will be covering. So I'll let people kind of take a look at those.
I have a question. So let's say that 2 or 3 people on the Policy and Legislation Committee would like to attend 1 or 2 of those topics. And I know you can only pay for one, but can we interchange? Like if Vanessa can attend 1 or 2 on a Tuesday and someone else on a Wednesday or whatever the days are. Is that possible to do?
I will, we'll check into that for sure, because it might just be a matter of, having the login. So whoever has the login logs in that day. And so we'll double check that as we register. So my thoughts is that that's probably possible, knowing that, as long as you just have the login credentials, you can log in, and it would only be one set of login credentials. So it wouldn't be possible for 5 people to use the same one and think they could all get in. But I do imagine that it's possible to share that. So we could have, 3, one person attending one day, one person attending the next, et cetera, et cetera. So.
Melissa, a quick question would be the N4A, is that the National Association for Area Agencies on Aging? And if so, is that the website where we can find this thing listed?
It is. And if you don't see it, Dave, when the meeting is over, I will forward this email to all the commission members.
Okay.
So you guys can all just see where the agenda link is, and you'll be able to look at that.
Okay.
Because I don't know if it's live on their website yet. It might not be.
Okay.
But so I just don't know. And I'll definitely forward it to everybody just in case it's not listed.
Okay, thank you.
Yeah. So we're not going to make any decisions right now, of course. Just wanted people to see the scope of what the workshops look like, and for the policy committee to be kind of taking this to heart and be prepared to assign attendance as possible.
Okay. So for the policy committee, it might be a good idea to just, via email or something, to have that discussion and then get the information back to you. Is that right, Melissa?
I think that we want it to come to you and I both, so that we are, both of us are aware of who's going to be attending.
Okay.
What. So if you guys would respond back to both Mitty and I, that would be great.
Okay, wonderful. Okay, any other questions for Vanessa or the policy subcommittee? Thank you for the good ideas, Dave, about Fort Collins and Weld County as well. That was great. All right, the next item I want to touch base on are the liaison reports. And in your agenda, if you don't have it in front of you, Melissa, can you put up that portion of the agenda where it lists all the liaison reports?
So I'm hoping that you see that.
There.
Yeah.
Is it not up right now? Information items, liaison.
Yes, that's it. That's it.
Okay, great.
Okay. And the only thing I wanted to say here is those are the agencies that the members have identified as those we would want to liaison with, to stay informed on what's happening, where the concerns are, and bringing that information back to our commission, as well as sharing with the agencies what our own commission is doing. So I just lost my visual. Sorry. Okay. As well as sharing with the commission, as well as sharing with these agencies what our commission is doing. So if you haven't designated an agency to liaison, please give us some thought. And there may be even more agencies that we haven't thought about. I just want to add my name to that list too. I'll be glad to liaison with the Department of Human Services in El Paso County, Department of Social Services in Teller County, as well as in Park County. And the reason I picked those, that governmental agency is because in my former life, I was involved with the Department of Human Services in child welfare. And while that's very different with senior services and resources, I do know some of the people at the local Department of Human Services, and I think I'll be able to be connected to those agencies, at those government facilities, and be tuned in or tied into what's going on there. So I would just like to add my name to those agencies. But do give it some thought, and if there are other agencies we haven't thought about, do let us know so we could add them to our list.
I'd like to add my name to the AARP one with Connie.
Oh, good.
Okay, great. Thank you, David.
It's a pretty big area. There's so many different aspects to it. So put me down for AARP.
Wonderful, wonderful. So give it some thought. I know Chuck and Debbie are new, so think it through, and you may be thinking of something else that we don't even have on the list. So bring that up as well. Okay.
And
Well,
Mitty,
Debbie-
Yes, go ahead.
Who?
so this is Melissa, just briefly. The Mobility Coordinating Committee, MCC, that was again Laura Cruz, who spoke up early. She's one of the guests on the call today. She is the PPACG staff that kind of really interfaces with the Mobility Coordinating Committee. So just to let people know and remind everybody that that's Laura. She's not necessarily the liaison for COA per se, but since people are seeing her on the call today, that might make people interested in learning a little bit more about mobility and the things that are happening in the mobility sector.
Melissa, are we talking mobility as far as transportation or more from a healthcare standpoint?
I'll let Laura comment a little bit on that, if that's okay, Laura.
Hi, thanks for the question. We're looking at it more from a transportation standpoint, but obviously healthcare is involved in that because our transportation specialists that are many of them that are a part of the Mobility Coordinating Committee are contractors for Medicaid and facilitate a lot of healthcare visits. So we kind of cross paths, but yes, it is our coordinating committee covers a broad spectrum of services in terms of transportation.
Great. So you could probably keep us up to date on what's happening with like Invita and Silver Key and transportation issues there.
Correct.
Perfect.
Perfect.
They're actually providers and grantees of some of our funds. So.
Okay, thank you, Laura. I appreciate that. Does anybody, and you can see where some members have put their names by things. Does anybody, I know we had marked David McEwen as talking about housing, but he couldn't do that today. And so we'll have to put that off for a later date. But does anybody else want to update the commission with anything? I'm thinking mostly of, right now, I'm thinking of the Senior Resource Council, and Connie,
Yes.
why don't you give us an update and also talk about the June 16th event?
Right. So, and I, you know, I could talk to Debbie, but she might want to take that over since she is the SRC executive director. But yeah, I'm very excited that we've been asked by the Education Committee to attend as the whole commission. So if you could all mark your calendars, as many of the commissioners as we can have on there. It's June 16th for the membership committee for the Senior Resource Council. And of course, it's still Zoom, and it's from 8:30 to 9:30, and it's a town hall format this time. So we have talked to Lucy about possibly doing a poll on what are the needs of the seniors. So that is still kind of in the works, but we'll let you know about that. But if you could mark your calendars, that would be wonderful. June 16th from 8:30 to 9:30.
Is that a Zoom meeting you said, or will that be in person, do we think?
No, it is Zoom. It is Zoom.
And we can send out the link, right?
We
Yeah.
can make sure we send you the registration link. Yes.
Okay,
Perfect.
great.
It's beneficial because it'll give all the members or individuals who come to that Senior Resource Council the benefit of knowing what the Commission on Aging is, who we are, and what we're doing.
Yep.
And it will give us the benefit of learning about needs that we may not know about or concerns that we may not be aware of.
Right. It's very exciting.
Oh, thank you for working with the Senior Resource Council, Connie, and getting that going.
Thank you, Connie.
No
Okay.
problem.
All right. So now we are on the agenda, the chair report, which is me. And what I've done is I put together 6 slides to share with you. And to make this easier, what I've done is I've included in the slides also one of the first discussion items, which is the mission and vision. But let's go through these slides. Let's see here. Okay. What I was thinking was, let's go back for a minute and just think about what we've accomplished from January through March. We started this commission in January. So the first 3 months, what have we done? Well, what we've done is we've started our monthly meetings, right? And we've established, we have bylaws now, and we have a statement of work. And my phone keeps going off. I'm sorry. Okay.
Oh, I wonder what that was.
That was me. Excuse me. So we have our bylaws and a statement of work. We also have established 2 subcommittees. We have the membership committee and we have the policy and legislation committee. The membership subcommittee has developed processes on interviewing and getting the application done and bringing in new members. And we've added 2 new members in March. That was Paula and Dave. And the membership committee is continuing to conduct, and 2 new members this month too.
Mhm.
They'll continue to conduct interviews to bring in new members. And remember, we have to cover a pretty wide area, 3 county areas and lots of little cities or jurisdictions in those 3 county areas. So they really need your ideas and help. And then the other subcommittee is the Policy and Legislation Subcommittee. And as Vanessa explained a few minutes ago, we've developed a method of tracking legislation, and we're going to focus to start on state legislation. We've also, as a committee, we've gotten some education. We've gotten some education from AAA. Melissa has spoken to us, explained her role to our commission and her role within the AAA, as well as Jessica, who explained her role in policy. We still need to hear from other members of AAA, and I know Jody's going to come at some point and talk to us. He's been busy with a family emergency, but we'll keep on doing that. The other thing we've done is we've been educated on innovations in aging. If you all remember, Claire was here last month to talk to us about the age-friendly report, that 5-year report. And then the other thing we've done is we've come up with this list of some agencies to liaison, and many members of the commission have volunteered to attend those meetings and bring back information and share information with the COA. Commission, I should say commission instead of COA. And I tend to use commission and committee interchangeable, and I'll try not to do that. We're the commission. Sometimes I say committee, and I don't mean to do that. But the other thing I want to say is we have a few members that have also let us know what their passions are. And that's important that all commission members have passions about one of the domain, right? Because that's what can rise to the top and move things along. And so David McEwen has said his passion was housing. David Betzler has indicated caregiving is a passion. I know one of my passions is employment and civic participation. So I know that each of you have a passion as well. So so make that known to all of us so we can move this forward. So anyway, is there anything I forgot that we have accomplished in January through March? Can anybody think of anything?
We are working on a logo.
Oh, yes, we're working on a logo. Absolutely. And the executive committee gave some ideas to Melissa, and Melissa is working with someone to put those ideas on paper in a graphic way, draw them out, and then we can bring that back to you to look at so we can have a logo. Absolutely. Melissa, how are we doing with that?
So Jessica McMullen and I have been kind of looking that over and coming up with some ideas for sure. We just she shared some things with me a week ago, and then we reconvened and talked about some things a little bit more yesterday. And so we're getting closer.
Okay, great.
Yeah.
Great. So let's move this slide forward to the next one, please. And what I want to do is I want to put together some short-term goals that we can come back and check in on after a few months to see how we're doing. Eventually, we're going to need some long-term goals too, but for right now, let's concentrate on short-term goals. So what are our goals for April through July 2021? And our executive committee did meet, and you know, some of the things on this page are thoughts of our executive committee, and you may have other ideas as well, which we can add. But the two that are highlighted are the most important ones right now, and that's establishing our mission and vision statement. And the second one is establishing a process of selecting which items will rise to the top in our collective minds about things that we as a collective group are going to focus on, right? Because there's a lot of things out there that we could be doing. We don't want to be spinning our wheels, so to speak. So what's the process of figuring out what we're going to focus on? What's going to be a primary goal that we're going to have, you know, even though we're working on all these little goals. So other ideas for April and July are that we'll continue to liaison with our selected agencies and bring back information. And we'd like to have at every meeting at least 1 to 3 members talking about what's going on in that agency they're the liaison for. And so if you want to get on the agenda for that, please let Melissa know so we'll know who's going to be speaking. And then obviously we'll need continual educational updates from the AAA and also the critical domain issues, you know, like transportation, housing, right? Social isolation, you know, all those domains that Claire talked about at our last meeting. And then obviously we want to continue our new membership search and continue our legislation tracking. So those are some short-term goals for the next 4 months. Does anybody have any others they would like to stick in here?
Sure. Mitty had asked me to take a look at some of this because we've had a separate back channel conversation. And I was kind of pushing the issue as far as strategy and objectives. And Mitty, I apologize for not getting it to you, but I have got a couple of pages of materials here, and I think it'd be worthwhile. I'll send that to you and you can look at it. And then for the next meeting, we'll probably have a little bit, you'll have some different thoughts on it. But a quick reaction to this particular one here. I think in my view, the real focus or probably a goal is that the relational, excuse me, let me just throw this out there. So I think that the domain areas are really what the focus has to be on, not organizations, not specific organizations. It's really the domain. So and that comes from either the innovations in aging or other sort of functional areas laid out there, housing, social participation, respect and social inclusion, blah, blah. There's a bunch of stuff, but the domain would be a key thing. One other piece as we go forward is that, like you pointed out, maybe we don't want to create or duplicate somebody else's efforts. So one of the early things I think needs to be to look at the existing documents that are out there from the AAA, from CASOA, which is a community advisory survey that's been done. And there are probably other documents, PPACG, their 4-year plan. Those things lay out their themes and their priorities. And to get that, to distill out that information, I think would be really helpful for us to sort of say, wow, okay, so if they're focusing on that, then perhaps we should either piggyback, or maybe there's an aspect of that that we'd like to emphasize as we go forward. I'm not downplaying the need for liaison reports, but that is more of a information sharing back and forth. So, I mean, that's one aspect. The other piece I kind of have come to as I try to craft this strategy and objectives, if you will, is really to try to get to what is it that the individual members are going to do when they're looking at a domain area. Is there something that we're trying to distill out or analyze or assess, whether it's an issue, it's a concern, it's a priority, it's a gap, whatever it may be? And then how do we make that actionable? How do we turn that into something tangible, if you will, that we, the commission, then can advocate, publicize, or maybe even leverage over into the policy arena? So that's kind of the key thing I think that Mitty has talked about. And I think that's really a major emphasis that we have to have, that it's not just gathering information, it's really looking at that, looking at the commonalities, the common themes. If we looked at all those organizations, probably if there are 20 of them listed, probably 15 of them have similar emphases across transportation or handicapped or meals or something else. So again, that's why the domain, I think, is the real focus. And then we can kind of use a filtering mechanism to say, okay, now individual organizations and priorities that they're working on, how does that reach and affect our domains? So Mitty, I hope to get this, I had a bunch of other things on the plate, but I'll get this to you before the end of the week, I promise.
Not a problem, David. Thank you for that. And one of my slides tried to capture some of that. We'll get to it in a minute. But you're right. It's a continuing conversation, but one we have to resolve in our minds so we can prioritize in a definitive way that does not allow for duplication, but gets us to the point of what it is we want to do in our 3-county area and to make an impact, because I think that's what all of us want, is to figure out where can we make an impact in a positive way to benefit seniors. Okay.
I think that I just to add something, I think that brings us back to why we're trying to get representation from Park County and go back to what we've been talking about, is the needs in Park County are going to be very different from El Paso or Teller. So until we have feelers out in those counties and we know how they're numbering what their needs are, I thought we were going to do a consensus of what all these areas wanted, like a numbered system, and then figure out where we were going to advocate from there based on like the top 3 or 4.
I think we can do both. We do have to understand the needs in our 3-county area, but at the same time, we need to come up with a process to make what are the questions we need to ask, and how do we get the cream to the top of the coffee cup, so to speak? Okay. All right.
And,
thank you for that.
Mitty, I'd like to just make a comment with
Sure.
Dave. I think he's exactly right about the importance of those domains and us really understanding those better and taking ownership of those domains. But in the meantime, too, I think part of the work with the liaison reports is to overlap and really understand and know what the other groups are doing. And so as the Commission on Aging develops its kind of policy stances, develops a better understanding of what the high need issues are, we would be able to know what the other groups are focusing on too. So if there's overlap with, you know, the Senior Resource Council, if there's overlap with DHS talking about issues. So that's, you know, the liaison piece, I think will become a little bit less important as time goes on and as the commission builds more in the domain areas. So I think you're right on, Dave, but I want to not let go of the fact that I think those liaison roles are, you know, somewhat important from that perspective. Does that make sense?
I agree 100%. And if you really think about it, the liaison for SRC or AARP, you can go to the website if they have it, or you look at their current plans or their long range plans. And now you start distilling out the key things that those individual organizations are focusing on. And then we, as Mitty said, we need to have a process whereby we capture that. And maybe it's a format for capturing that for each organization, so that we then can compare and figure out where the overlaps are and what is missing as we look at the overall domain. But there's a lot of work. It's not just go to a meeting and say, hey, we commission had a meeting and USRC or UX organization XYZ had a meeting, and bring that back to our monthly meeting. It really is trying to digest and assimilate what are the key things that organization that you've raised your hand to be the liaison on, what are they really working on, and how possibly does that relate to what we, the commission, are thinking needs to be emphasized in our 3-county area.
And the other thing, let me just say this, it's all important. It's like a wheel, right? With all the spokes in it. They're all important. And part of that liaison too, I just want to add this, is relationships. Because as commission members, we have to build relationships with the other agencies in order to, once we, you know, we say, okay, this is a big focus for us. We want those relationships because we'll be working together in partnership in all probability with many of the area in the 3-county areas, with many of those organizations. So it is important for us to build those relationships as well.
Correct.
Okay, more to come, obviously, lots more to come. Okay, can we go to the next slide? All right, and Melissa, can you, when you send out the minutes, can you send out these slides as well? Okay, great. The next 2 slides are just some comments around mission and vision. I gave you just a little description of what a mission is. You know, it's very detailed. How are we going to achieve our vision? And our vision is, what do we want in the future? I gave you some examples of mission statements and vision statements in that first slide there. And I'm not going to go over those. You can go over those later. But let's go to the next slide real quick. I also gave you some aging examples of mission and vision statements. The last one here is our innovations on aging. It's their mission statement and their vision statement. And then the very next slide, I know I'm going through this quickly. The very next slide was our mission statement from when the commission belonged to the city. When the Commission on Aging was part of the city, this was our mission statement. Here's what I would like to do next. I would like all commission members to give some thought to what a mission and vision statement might look like for us, and email your ideas to either Melissa or myself. Then I would like to get a small little temporary subcommittee going, maybe 2 or 3 people. And during this next month, we'll craft some ideas around mission and vision and bring them back to the larger commission in May. Does that sound like it might be a plan?
Yes, I'll be happy to be one of those 2 or 3 people.
Okay, do I have another person who would like to
I will. It's Connie.
Connie, okay, great. Hi, Dave, Connie, myself, anybody else? Okay, then we'll get a little meeting going and we'll come up with some ideas and bring them back to you in May. All right, and so then hopefully I said here by June, we'll have decided on what our mission and value statement will be. And that's going to be our, that'll take care of one short-term goal.
Related
Okay.
to that would be a request that if when the members come up with their ideas on a mission and a vision, that they would send it to Connie and me as well.
Yes, so Melissa, can you send out emails for all of us on this little work group? So everyone can send their ideas. Thank you.
Bet.
Okay, and my last slide was actually talking about what Dave just talked about. And I want to thank you, Dave, for the conversation. We've had some conversation around this, obviously. Dave calls it a strategy approach sequence. I'm calling it a blueprint or a map that we need to guide us in the direction we want to go. Remember, we're covering 3 counties, many different jurisdictions that are different from urban to rural, right? We're covering multiple domains, and there are many agencies and organizations working in these 3 counties that are looking at some of the same things we'll be looking at. So these are all things we're going to have to juggle, right? And so, so what we need to do is have a method or a blueprint, as Dave said. I put down some thoughts here. You know, we have to know what the unmet need is. We have to know if it falls under a domain. We have to know who to bring into this conversation that we're talking about. You know, if it's transportation, what transportation agencies or services do we also have to be talking to? Those individuals, those agencies. And then we have to figure out, so what's our role? What are we going to do with this? You know, are we going to monitor it? Are we going to seek more education around it? Do we want to figure out how to develop policy around it? So there's all these questions we have to juggle. And then what will be our objective and what's our timeline? So that whole process, Dave is much better at articulating than I am. I just recognize that we need a blueprint, a map to help us move forward. So Dave is going to send me some information. We'll continue the dialogue. I'm going to pull in the executive committee to continue that dialogue as well, so we can come up with the plan or the process. Does that make sense to everybody?
Yes.
Okay. On that note, let's move on. That concludes my chair report. So let's move on. We have some discussion items, and we're going to start with the caregiver registry. And that is going to be Dave. And I see you have a guest here too, Kent.
Kent is also here, and he's really the expert.
Yes.
I'm
Okay.
an advocate and a passionate guy on it. So the caregiver registry, I've done a little bit of research, and I came across something, I can't remember exactly where, that talked about potentially the need for caregivers to be registered so that the resources supporting caregivers, the resources writ large, would then be able to have a listing, if you will, of those caregivers that need support in area A or B or C or D. So I kind of fixated on the registry idea. And then I talked with Kent, and he quickly said, no, Dave, that's not a big important thing. The real key thing is that the caregivers themselves don't see, this is family members now, they're family members. They don't see themselves as they don't define themselves as caregivers. It's a familial support. They are just supporting their spouse, their brother, their aunt, uncle, father, whatever it may be. They don't define themselves as caregivers, which is part of the challenge then for organizations, entities that really say, wow, we want to support caregivers. Well, if part of that, a big chunk of the caregivers don't identify that way, how do we reach them? How do we tailor our messages so that they feel that, oh, okay, there's some people that are really, or organizations or resources that are trying to support us and that they exist out there, and here's how I can access them. So that's really the focus on that caregiving piece. It's not a registry per se. It's really an understanding that that we should kind of accept is that many family members that are in that very difficult and challenging, sometimes lifelong role of caregiver see themselves as family support. They're just supporting a loved one. So I don't, the registry is not really the central part. Kent, do you have other thoughts along that line?
Oh, yeah, I have a lot of thoughts.
They're good ones.
So some of the commission members know me, some don't. Real quickly, social work is my second career. I'm a master degreed social worker. I've been doing this for 29 years. My first 15 years was doing hospice social work. My last 14 years have been with the Family Caregiver Support Center at the Area Agency on Aging. And what I discovered when I started within the first 6 months after starting with the Family Caregiver Support Program at the Area Agency on Aging, I was doing pretty much what I did with as a hospice social worker, helping family caregivers understand the resources in the community, how to access the resources, and then also provide the emotional support. And to be really honest, and I think I said this to Dave, you know, why do we want a registry of caregivers when we don't have a registry of anybody else that's providing healthcare? That seems rather, and I'm thinking there would be a lot of people who wouldn't even want to have their name on the registry for a lot of different reasons. But the primary one, which is what Dave said, most family caregivers do not identify themselves as a family caregiver. They are the son, the daughter, the granddaughter, the spouse, and they're doing what they're supposed to be doing as a family member. And they don't come into the Family Caregiver Support Center until they've hit a wall, whether it's an emotional wall or a resource wall or something that they can't figure out. And so we're helping them, as we're now refining this piece, we're helping them identify the different puzzles of the, to help them with the caregiving. One thing that Dave and I, well, and I had mentioned this in another meeting, whatever we can do to support family caregivers in their role is going to be huge between now and over the next 30 or 40 years. Family caregivers have long been the backbone of long-term care in this society. A very, very small portion of people who need care are in care facilities, whether it's assisted living facilities or nursing facilities. The vast majority are living in their own homes, being cared for by a family member. Here's real briefly. As of right now, for every family member that needs a caregiver, a family member to take care of them, the ratio is about 5 to 1, 4 to 1. In about 9 years from now, in 2030, that ratio goes down to 3 to 1. In 2050, when all of the boomers, me included, are 80 and over, that ratio goes to 2 to 1, meaning there's going to be 2 family members for every family member that needs a caregiver. And the frightening statistic is the millennials, they're the echo boom. Their generation is bigger than the boomer generation because we're starting to die off. But they are as big as the boomer generation, and their family sizes are smaller. They're only going to have 1 or 2 kids. They're not going to have 5, 6 like the boomers did. They're going to have smaller kids. So that is going to continue, and we are not going to be able to rely on family members to be the silent caregivers. We're going to have to put together resources within the community to support the family caregivers. Women who leave the workforce to care for a family member. When they go back to work, the research shows that they are paid less when they go back to work than what they were being paid when they left the workforce. So they're putting themselves at an economic advantage just by being a family caregiver. But the other statistic with women who leave the workforce is when they get to old age and they need to require help and assistance, they're going to be economically disadvantaged. They're going to be in the poorhouse. And so we can't continue to do what we're doing and rely on family members and say, oh, they're just doing what they're supposed to be doing. And that falls into this whole area of, and Dave and I had a good conversation about this. Philosophically in our country, we have to get rid of this. I'm independent, self-sufficient. I don't need your help. Thank you very much. I'm the big, strong, independent individual. We need to begin to developing, starting 3 years ago, a philosophy of interdependence. When we're born, we are interdependent. And then as we grow up, we're given the illusion that we're independent. Oh, go out and work on your own, start your own family, live on your own. I'm independent. But in reality, even as adults, we are always interdependent. We just don't realize that. And then when we hit old age, because we're living longer, but we're also living with more and more debility as we're living longer, we become interdependent again. But because we bought into the myth of being independent, the story I hear from family members almost all of the time is we want to help mom and dad, but they are refusing our help. Why are they refusing our help? Because they are independent, self-sufficient. I don't need your help. Get out of my life. And going back to, and this is where Dave and I had a good discussion. So I've been on a number of committees in the community on the transitions in care because Medicare is still finding hospitals. If you have an individual and they come in and they receive services and you send them home and then they come back within a very short period of time, Medicare is going to find the hospital for that quick turnaround. And so hospitals are trying to talk about going back and forth between the hospitals and the care facilities in those transitions. Nobody was having a conversation about the transitions that seniors go through when they go to they've been living in their own home, they go into the hospital, and after the hospital and after the rehab, they go back home. Nobody talks about that transition. And and where it begins to break down is the fact that depending on the circumstances, seniors are ill-equipped to continue their rehab alone on their own a lot of times because of cognitive incapacities, because of how they view themselves. I don't want this damn walker. I'm gonna walk on my own even if it kills me. I don't care if I fall so many times. And we have hundreds of programs about fall prevention. Okay. But the bottom line is if a person's gonna fall, they're gonna fall. That doesn't mean we shouldn't try to do programs to prevent it, but we're focused on the wrong thing when we do the programs. And nobody's talking about when the senior who's living alone, or even the senior who has a caregiver, how do you help them at home with that transition? And the transition has to be more than therapy, has to be more than the physical therapy or the occupational therapy or the speech therapy, because that's just fixing the problem. It goes beyond into the social determinants. What other social services do they now need because of what sent them into the hospital? Now they have more difficulty with transportation of getting to the store to shop, or it's not as easy for them to do care in the home, or it's not as easy for them to manage the finances. That's not touched on. All we do is talk about the speech therapy, physical therapy, and occupational therapy. And if we do that, then they're still able to do all of the other things. That's a wrong assumption.
Let me interject if I could, Kent. What you're doing is giving a wonderful sermon. And he is a wonderful preacher on this topic. He is so passionate and so knowledgeable. It's really, really important. Let me draw a couple pieces out of that. So looking at other materials that are available on caregiving, I came across the Rosalind Carter Institute for something, Rosalind Carter Institute for Caregiving on 30 July last summer. She came out with a letter to Pelosi, McCarthy in the House, so Democrat and Republican leaders in the House and in the Senate. And she said policy and advocacy related things that this organization, the Carter Institute, is recommending. So this ties exactly to what Kent is saying. Here's the policy application that we, if you're passionate about an issue or a domain, look for that policy piece. Here's what the Carter Institute has said for the lawmakers in last summer. Consider expanding paid family leave beyond childcare to include elder care. Oh, so that could be a policy and an advocacy role for the commission to educate our commissioners and our constituents, if you will, that there's a potential step forward in progress. Another one, ensure family caregiver access to some designated grants. For community healthcare and engagements, consider expanding it to caregiver support programs to ensure our frontline unpaid family caregivers have accessible interventions. Those are just two quick things. But the key
and Dave, I'm going to bring it closer to home. This is it's the 2020 Strategic Action Plan on Aging from the Strategic Action Planning Group on Aging. It's a 90-some page document, and they have some wonderful, wonderful suggestions in here on policies and everything that you all as a commission can focus on for aging within the state of Colorado. I mean, I've dog-eared a couple pages. Establish family leave policies that set standards for compensating employees who are caring for aging family members. Identify and promote best practices for educating and supporting employees who are family caregivers. Let's see.
Yeah, clearly there are a number of different studies and reports that will identify those aspects that can be emphasized both from an advocacy and a policy development perspective. And I think that it just points out that in the caregiving area here, this is one small but very important area, something we're passionate about, but it probably is replicated across each and every one of the issues or domains that are out there. There are a number of different organizations that have looked and are struggling mightily, trying to move that ball down the field as far as getting to actual supports and improvements and enhancements to the existing resources, both advocacy and policy. So it's just a heads up from my perspective as we, the commission, move forward. Those are the types of things we need to be thinking about and report back then after we've uncovered these in existing documents, report back to the commission. Here specifically is a policy or an advocacy related thing. And Mitty, that's what I'm kind of getting to in this strategy and stuff that I'll promise you by the end of the week, okay?
Is there anywhere that we can, is there anywhere that it's already housed where there's like a caregiver network? Because a lot of like, you know, when this happens to families, it happens very, very quickly. And it happens when they're in the hospital and they're making a decision. Is there some kind of, is all of this information housed somewhere? Because I always used to have to educate families on the fly too. And it's, if you don't know and you've never been in this arena, and suppose you live in Austin and mom and dad fell here, how do you know to go to the Pikes Peak, like the AAA, to their website? Like, what is the easiest, simplest ways for us to help people on the fly and get them this information for caregivers?
So, Elisa, to answer that question, my comment would be you get them in touch with a AAA that serves their area.
Okay.
Because every AAA, the Older Americans Act mandates that every county in the country has a AAA assigned to it to provide services for seniors and family caregivers in their county. Now, it will vary from AAA to AAA how they do that. But the best starting source for most places would be the AAA in that county. You know, for us, it's in El Paso, Park and Tiller County, it's us, the Pikes Peak Area Agency on Aging. But if you wanted to find any area agency, you can go to n4a.org, put in the name of the city, the zip code, and it'll pull up the entity that serves as the area agency on aging for that. The reason there is not one place to go, I'm going to probably, caregiving is so complex, so different from family to family that you cannot put it all in one place and just send everybody to that one place and it'll all be taken care of. What makes the Family Caregiver Support Center at our AAA work so well is because we just don't give them the resources and send them on their way.
Right.
What we do is we sit down and we have a conversation with them about the caregiving. We listen to the heartache. We listen to all of the emotional challenges that they have. We provide them with the pieces of the puzzle, and those pieces of the puzzle cover medical, legal, financial, care, whether it's in a facility or at home, and emotional support. We identify those resources, but then we begin to validate for them everything that they're struggling with. We provide that initial emotional support. And that's huge because caregivers almost always think that something is wrong with them because our society teaches people, if you do this way, you will fix it. Well, if you're caring for mom and dad who have any kind of cognitive impairment like dementia, you could do everything mechanically correctly, and it's not going to fix the problem because their dementia is going to screw everything up all the time.
Right. I think I was more talking like, I'm talking about like what I used to deal with from is mom and dad don't have dementia, or one of them falls, and this is a very, very quick thing, and you're out of state and you're trying to harness information and resources. And if you've never been in this arena, it's very hard. All of us on this panel are using industry specific wording, all of this. And from what I heard being in housing, even the layman's terms we're using to each other, they don't understand them. So
Right.
I'm saying from a commission, as an educational standpoint, for somebody who's never even dipped their toes in this arena, but immediately finds themselves in some kind of tragic situation, how do we educate on the fly and show them where to go? Like, not everybody has time to call the PPACG and set up an appointment. Like, if mom or dad fell and they cannot return home, what do they have? 20 days. So where do they quickly, like,
So-
what can I do?
So in that kind of a phone call, I would be working with the family caregiver and encourage them to slow down and take a breath. And then, what's your question is good, but it hits the crux of our social service delivery system. Depending on the circumstance and the situation, to try to line up social services, it's not like ordering pizza. Meaning, you pick up the phone, and so I understand the question you're asking, but when you give the name and phone number for this particular resource and say, ask them about this to get this set up, it may take them 3 to 4 weeks or maybe longer to get it set up.
Yeah, that's my point. That's what I was saying.
There is, that's the crux and the challenge of family caregiving, is that it's not an easy fix.
No, I understand that. I'm talking about like emergency situations, like us as a commission helping people ascertain information.
Send them to us,
And
send them to the Family Caregiver Support Center. We will walk them through that and give them as much information as they want. In fact, we oftentimes give them way too much information.
The other,
And can I go ahead, Dave?
yeah,
We're
just
gonna say
quickly, I was going to say that Kent is very, very effective and proactive in going out to the community and talking about caregiving. He gives presentations all over. So the key thing that we take away from this caregiver discussion we've just had, I think, is that there's a proactive educational piece that has to happen, not to necessarily the caregivers that are going to experience it tomorrow or next month or next year, but to my kids. My two daughters are 43 and 45. They should be thinking about, and they are, about, okay, what do they do with dad in case this happens, or he gets hit by a bus and mom is left on her own, what do we do now? So that's that proactive education, preparedness, lots of different pieces. This is just caregiving. So keep in mind that there are probably 50 different issues that we could be discussing, and as deeply as this one, that we need to consider all the ramifications of that.
Thank you.
And Dave and Elisa, here's what makes it challenging. When those things happen, like using Dave and his kids, if something were to happen to Dave and his kids had to step into emergency, the thing that makes it so difficult to handle is the emotions that come with that, because they're talking about dad. And now all of a sudden, everything gets blown up because this is dad, this is mom. And that's what makes this such a challenging issue, is that emotional piece. You can't let go of the emotional piece. I understand everything, but that emotional piece clouds everything. It does.
Kent,
Yes.
I want to say, man, I can tell that individuals who come to you will get the help they need, because you are definitely passionate about that. And I'm so glad you're in our jurisdiction, because you'll certainly be a resource for all of us. What I take away from this conversation is it's truly multidimensional. And I agree with Dave, it's a big education piece that starts really early and continues throughout life, right? So it's a society mindset that we're not going to resolve immediately, but it's important and something that probably needs to happen. And the other thing I took away from this was the idea of policy or legislation that expands that family caregiving benefits, right? So, so much to think about. And I'm sure we'll all be thinking about it. And I want to thank you so much, Kent, and you too, Dave, for raising our awareness of this. And I'm not quite sure where we go now, but it's there in our heads, and we will circle back to this for sure. And maybe we can use this, Dave. I know you're going to be talking some more to us. Maybe we can use this as like a platform, teaching platform on how we process a topic like that and drill down to what we as a commission can do. Okay. I don't know how much time we have left, Melissa. Do we have time to talk about the behavioral health or not?
So we are technically, our meeting can go until 5 o'clock. So we are doing okay with time. I know in other instances we've ended early, but this is probably one of our more robust meetings, which this is what we're here for, to start to get to this level of conversation. So I think it's been really good. What I put up on the screen, and I hope it looks different for you all. I hope you're seeing kind of an Excel spreadsheet that says rec and leisure, work volunteer, government advocacy. Does that,
Yeah, we
great.
see it.
Yes, that's it.
So for those that are on the call today, what this is the AARP domains. So, and the age-friendly domains. So what Dave Betzler and what some of us were referring to earlier, these are the different areas that, talking about what are the needs. So transportation, housing, rec, leisure, work volunteer, et cetera, et cetera. So that's what's kind of going across the top here. And so the conversation around family caregiving that, you know, Dave has kind of brought up as a thing that he was thinking would be something we want to dig into, has actually brought examples of policy that are being talked about right now. You know, I just kind of put it on the chart. This is all a work in progress, commission members. So commission members, as you come up with a better way to track this, you know, we will morph it, we will change it. So definitely a work in progress. So I just kind of put under here family caregiving under the health and wellness area, you know, just to show that how the conversation that's happening today fits into the context of moving to another level of advocacy and work. And I'm so glad that Dave brought the policy examples that are out there happening as we speak. So really good examples. Before I talk about behavioral health beds, I just wanted to see if anybody had any comments about kind of these, you know, domains, and you see how they're kind of fitting into the conversation.
I have a comment real quick. You know, for those of you on the call, I came from food banking in Tennessee. So along with Melissa was a former food banker as well. So you have a bunch of food policy people on the call. But one of the things that is just also something to kind of suggest when you're thinking about policy is not just state or federal policy, but also policies within the constructs of our healthcare system. So individual policies within the healthcare system that we have to also be advocates for those patients and those seniors to help kind of change some of the more some of those smaller specific things to systems and how they operate. And so one of the things that as Kent was talking, and I think it's Elisa, did I say that right?
Yes.
Okay. I think one of the things too, in all the services that we offer is specifically how do we capture those that are turning into either long-term care facilities as well as home care facilities, and how do we make for sure that those families, as Elisa said, are equipped to be able to move forward with whatever situation that they're in. And part of that is that at that policy level of the hospital, you know, who is doing that discharge? What is the case manager's procedures on how they are what information they are giving those those loved ones that are taking care of that individual, and how do we get that message either standardized, well, first changed and standardized, so that there is a complete message going to each one of those individuals who is going to have to take care of a loved one. So not just looking at policy level on, you know, federal or state or local, but also the policies within the systems that care for those that we're talking about today.
Well said,
Families
Laura.
care
Thank
for them
you.
once they leave. Agreed.
Well said, Laura. Important piece.
So I'll jump in and share a little bit about the next agenda item, which I'm not going to put the agenda back up because I want to keep this domain document up for people just to reflect on. So the Ethics and Behavioral Health Subcommittee that meets for the community on the first Friday of every month at 7:30 in the morning has repeatedly discussed the fact that there are no behavioral health beds for Medicaid people and people who have really more significant needs in the senior community. And so oftentimes they will stay in hospitals longer than they need to. They will remain medicated longer than they need to. They will be discharged, speaking of discharging people, out onto the streets. And it's been an ongoing conversation for as long as I've been a part of this organization, which is 2 years now. And there are some ideas and solutions out there, and there was legislation that was passed. And so after the last meeting that happened in, I guess it was March, it was brought up that we would look at creating a subcommittee to revisit some of that legislation, revisit some ideas around getting some behavioral health beds into the community, and also some other pieces around behavioral health needs for older adults that are usually in a facility type situation. And so I had actually been, I spent quite a bit of time talking with Chrissy Swanson. She is a nursing home administrator and one of the more four leading faces in the community around this issue. It was possible that she might become a member of the Commission on Aging. And so there's been conversations between myself, Connie, Chrissy, but then also the advocacy committee. And I apologize, Vanessa, I did not include you in some of those emails. I was only emailing Claire and Kelsey. So, but now I know I have to email you, because it looks like there would be a significant engagement opportunity for the Commission on Aging to look at doing some advocacy around the legislation that was passed already, but not funded, and the need to continue to bring this subject to the attention of legislators and the community. And so what we were hoping to do, and I think we'll have more of this next month possibly, is that the advocacy committee would actually be reviewing these things. They would actually be reviewing the caregiver ideas around policy. They would actually be reviewing the behavioral health policies and seeing if the commission wants to be writing a letter, wants to be setting up meetings. And of course, overlapping that with Jessica McMullen and the PPACG legislation pieces that happen. And so that's kind of how this is all going to start to kind of fit together. And we don't have it all figured out right now, but we're seeing that today, which is, I think, very exciting, both from the caregiver perspective as well as this shortage of behavioral health beds, there are actually some legislative actions that could be kind of embraced and explored more. And so I would just say that this information needs to be taken to that advocacy committee, who's now got that regular monthly meeting set up. And so you guys are going to have your agendas full, digging into these pieces and looking at them and deciding, is it just a letter that gets written? Do you want to actually set up meetings with specific legislators and actually bring this forward? But then also as the commission gets really busy, it's going to be really important to have that process in place, deciding, what are these things that we're going to jump on? Right now it's kind of easy because I think there's just two being presented right now. But as the commission gets busier, there's going to be a lot of issues that potentially get brought forward. So again, having that process in place of how to decide which issues to move forward on is going to be really important. So I'm not going to share any more about that behavioral bed piece other than just that, I'm going to be encouraging Chrissy Swanson to be meeting with the advocacy committee to let them know kind of what's going on there. And then the advocacy committee will be able to take it further. And so as I look at this domain chart, again, I could put under health and wellness, possibly even safety. It might be more of a safety issue. This idea that older adults are being discharged to unsafe places and they are not being given the dignity and respect that they deserve. And it's just, it's really lacking. So just for the sake of experimenting here, I'm going to put it, I think, just under safety, but it could be a health and wellness thing. I don't see it fitting under any of the other pieces by any stretch of the imagination, maybe housing a little bit. But just, this is, something to just kind of keep playing with for the commission. And eventually we'll have a really great process that works and can be tracking the projects and the efforts underway. So any questions about the behavioral health bed shortage.
Yes, I had a question. Did I hear you right when you said there were 2 bills pending? Is that what you said? Around,
Actually, no, there was one bill in the behavioral health side that was actually passed. I think it was 2 years ago that it was passed. And one of the AAA's previous ombudsmen, as well as Chrissy Swanson, were individuals who were part of getting that bill crafted and passed. So the AAA carried a role when that legislation was passed before. But what we would like to see happen is a conversation around what happened to that legislation, what's going to happen going forward, because apparently this is not just a problem for El Paso County, it is a problem statewide. So there's a lot at stake there.
Melissa, as far as you keep referring to beds, is there any piece that we can know more information about mobile assessments going to people's homes? I know Peakview does mobile assessments, and where is that in the other counties that we serve? Is that an issue? Because if there's no beds and there's a crisis at home, or I know the mobile assessment teams go to communities too. So is that tied into that kind of?
I think it's more after something like that happens, Elisa, because really, the Elder Abuse Coalition ends up, doing emergency placement for people. And a lot of times that will be a hospital setting. And then the problem is, where does that person go after the hospital? And so what happens is they may stay in the hospital, or they may be discharged to the street. Or as Kent and Dave brought up with the family caregiver situation, they may be discharged back home, but not with appropriate care. So there is definitely a piece there, but really, the assessment, the mobile assessments that might happen have really pretty much already happened. It's the fact that now, what happens with this individual, and where can they get the most appropriate, least restrictive support and care for them.
so I had another question around that. You said there were no behavioral health beds. Is it just for Medicaid, no Medicaid behavioral health beds, or no behavioral health beds, period?
It really is almost period. There is a concern, especially around Medicaid, but it is kind of a concern overall. So even, if a person isn't a Medicaid recipient, it's really hard to get them the right support that they need to have a more long-term plan in place to help them with their care. So it's really all, but especially the Medicaid side of things right now.
And we were talking about some of those, when you go into those kind of situations, a lot of them don't consider dementia to be behavioral health and might not cover it. So that's a factor for the families too.
So
with that, I'll put the agenda back up, I think. I hope. All right.
All right, so Melissa, you're going to keep us informed. We're going to pull in our policy and legislation subcommittee to connect with Chrissy, right?
Correct. Yep. We were trying to do that before. But again, Claire, she decided she needed to have a kid.
Well,
so anyway.
that will happen, right? Life.
Yep.
Right.
Yep.
Okay. Thank you, Melissa. All right. So Alyssa, intergenerational housing, you were going to speak to that, right?
Yeah, we had talked about that. I was going to try and investigate, and I talked to the Colorado Senior Lobby about that. I read articles about these kind of things happening all over the U.S., and I didn't know whether Colorado, and more specifically, like the counties we're talking about, is ever going to entertain those kind of ideas. And I understand that building and the builders, everything is, revenue driven. But statistically, I think that would hit on a couple of points. Isolation, like they're building daycare centers on senior living campuses and things like that, and more. I think a lot of families, especially ethnic families, live together under one household. And I know that kind of ties into what Colorado Springs is doing with what do you call those? Where more than 3 or 4 unrelated people can live under a roof. Like Colorado Springs is already doing all of that. Do you know what I'm saying? Like multiple family members can live under one household, or multiple people, or whatever that is. But I think it would be more affordable. And even if you're not blood related, but you consider this person like it's your godmother or something, if we knew more about these different housing that is coming to the Springs, or, is there something going on in Park County or Teller County or any of these things? Because it's my understanding across the full state, there's a lack of housing just in general. And then we keep using the word, affordable, but I mean, even affordable is not affordable to some.
So, Alyssa, it sounds like housing might be a passion for you. This is just a thought or an idea, because I know David McEwen said it was a passion for him. I'm wondering if the two of you can kind of get together and look at the resources, or who else you might need to talk to, and figure out, what the need is. I think David's got a lot of information about this, and I can't speak to all the information he has, but I think it'd be a good place to start, since he's a commission member too, and see if you can just divide up kind of that housing issue, gather some more information, and maybe bring that back to us. I know Dave wanted to speak to the members about it, and it just hasn't happened yet, but I'm wondering if the two of you could get together and
maybe we can break it down from like assisted living communities. And to be honest, I don't know how, as less and less people are using long-term care insurance, it's not a thing that we purchased like, our grandparents once did. And having come from working inside a community, it's very, I don't know how most people can afford it. It's a very, it takes a lot of money to stay in an assisted living or a long-term facility or memory care. You're talking it could be anywhere from like $4,000 to $17,000 a month, depending on where you're at. So you really have to have these resources for a long time. So yeah, I will get with David and we can talk about communities versus in-home care, versus if we have any, builders that are trying to come up with some different.
To not reinvent the wheel, the housing domain under the innovations of aging has a lot of this information. Just like what's affordable housing? It's if you're spending less than 30% of your income to cover your roof. That's what affordable housing is. Anything that's less than 30% of income.
I'll reach out to Claire and ask her. She might be know some of what's going on in that arena.
I probably can get you Leo's name. He kind of chairs that, or David Lord.
Okay,
David Lord is the chair of that. But let's let her take care of her baby. Yeah. I'll get with you on that. Okay.
Thank you, Connie.
And
I just noticed, I just want to say, by way of education, Kent had put something in the chat to remind us that dementia is considered a medical issue, not a behavioral issue. And when a person has both dementia and mental health issues, the person can become a ping pong ball that experiences difficulty in getting appropriate care and treatment. So thank you for that education piece.
I have to drop off.
I do too.
Okay.
Take care, everybody.
Thank you.
Is the meeting on the 5th going to be live or another Zoom?
That's a good question. I hope it's going to be live, but I can't make that decision.
So
No, we're
Melissa,
gonna be-
you're shaking your head. AAA is not going to allow it?
Not yet. No, we're working on, and Jessica McMullen might have more to share
Okay.
about that, but I don't think we're ready yet.
All right. Thanks very much. I really appreciate it. It was a good meeting, I
Okay.
think. Thank you.
Yes, it
Minnie.
was.
Thank you.
Oh,
Thank
Bye.
you.
Bye.
So, please note I'm sorry, do you have the calendars or anything we should note, Melissa?
I will. I'll put that up in 1 second. One more thing about housing. In the chat, there was a comment just to me that was shared about LGBT housing as well. You know, we have a person on our AAA staff who actually did her master's thesis on LGBTIQA in long-term care facilities. And so she is a tremendous resource and also a reminder of, you know, the injustices and the misunderstandings that can be happening around that, those groups of people and serving their needs. So when we're thinking about housing, to also keep that in mind too. That being said, the calendar, I'm going to scroll down here for a second, and we can talk about calendar and any announcements that people have. So give me a second, I'll get there. So here's our little calendar. So there you go.
Okay, does anybody have any reminders or anything to put on the calendar that should go on there? Okay, executive committee, don't forget, we have a meeting coming up Monday,
Monday at 11, right?
right? And
The other thing that's on here, that's a new thing. This is the PPACG kind of meeting schedules, just to let people know the scope of some of the other subcommittees that meet for the PPACG, and then also some of the training classes that are happening through the AAA.
that's on the website, right?
Yep, it is.
Okay,
Yep.
yeah, that's what I thought. Okay.
I was just I have a question. Maybe this is more Melissa. Senior Lobby was asking me to volunteer on one of their committees for stuff for Older Americans Month. Is there anything like the PPACG does that we can push out information for May? Or do you guys send out like educational stuff, or could we, or?
So in years past, we have been very active around the Older Americans Month. Right now, I have absolutely nothing on my radar to do for Older Americans Month. So Elisa, maybe you and I can have a little special powwow, brainstorm some ideas. Anybody else interested? Because I was gonna, as the calendar was up, I was gonna remind people that May is Older Americans Month. And there's a theme that they have. And do you happen to know the theme, Elisa, off the top of your head?
I don't. They haven't sent me an invitation, but I can kind of share with you too, Melissa, when I know what the Colorado Senior Lobby is going to do too.
Great, great. Yeah, let's plan on educating everybody about it. And, you know, people can be thinking that May is Older Americans Month, and do some special thoughts and activities around there. I want to say that the theme is something like Communities Stronger or something like that. It was really kind of a tied to a COVID thing. Anyway, but we'll talk more, Elisa, and get the words out to everybody.
Perfect. Sounds good, Melissa.
One more thing, Melissa, in terms of the mission and policy, can you send all the committee members, Connie, Dave, Betzler, and my email and the PowerPoint on mission and vision, so they can send ideas and thoughts to us as we play with this during this next month? Thank you.
Yeah.
Okay, everybody. I guess that's it. I appreciate your time and the conversation. And again, welcome, Debbie. And we'll be talking to you all soon.
Is there a way I can Mitty, is there a way I can talk to you and Melissa after everybody gets off?
Yes,
I think we
keep it
can
on.
just stay on. We just stay
Okay.
on. Okay. Bye.
Bye. I can't see